it's a mediocre performer on consumer outcomes. If you do a bang for the buck adjustment, Canada spends a lot of money, and based on our indicators, it scored the lowest of the 33 countries in terms of banking. There have been some signs of progress. Since we started in 2008, we have moved up slightly in the scores. There is discussions of wait time guarantees, and you are seeing an issue around bringing new pharmaceuticals into the marketplace a little faster. So how do we improve? We talk about something called the Bismarck advantage, which is there are two types of systems in Europe. The Bismarck system, where the government is both the provider and the purchaser of the service. Now that's the beverage model, I'm sorry. The Bismarck model has a separation between the purchaser and the provider. So the top scoring countries had a split between the government as the funder and competing providers. So X rates by 50%. Again, by simply moving removing the monopoly, having buying from competing suppliers. And we don't have enough time, but the next slide. Sweden is very decentralized, so local government is where healthcare is provided. So in the Stockholm area, you have this purchaser-provider split, but there are regions in Sweden where they run it like the Canadian health system, where the government is both the purchaser and the provider. And what these stats here are showing you is that the waiting lists in the Stockholm area are far lower than outside where they're using the old model. So it's a win-win situation in Sweden. Better focused care. The appearance of the ability to choose between many different options. And what's interesting in Sweden is there is a move by the unions, for example, the nurses union, to get into the business of healthcare. You have nurses actually running hospital or healthcare companies with profit sharing, and so again, you have a diverse set of suppliers, still funded centrally in a single payer system. One of the advantages is that the politicians have to get out of these things. Our politicians are too involved in healthcare. So the politicians really now have a system where there is a market and there's competition going on between the public and private clinics, sort of sink or swim. And we had Johan in Manitoba, and we have lots of hospitals in rural Manitoba that are running at 10 to 20% capacity because we have a global budgeting system. So they simply get their budget from last year and they add 4% on for inflation, but those hospitals might be running at 10% capacity. In this model here, what would happen is that they would get paid based on the volume of use. And what that would mean is a hospital in Boulder, Manitoba would now get, if it's running at 10% capacity, it would get 10% of its budget. The politicians would be outside of it. That facility in Boulder would have to either close or reinvent itself. And that's one thing that we need to do. The politicians are far too involved in healthcare, and we have lots of facilities that are open just for political reasons. You need to have a pricing system if you go to their model. I'm sure you've all heard of diagnostic-related groups. It's used in the US as well. You have prices, and I met in Stockholm with the purchasing authority, and they have a very sophisticated way of pricing hip replacements and all sorts of procedures. What it did was created a benchmark, and if an entrepreneurial clinic wanted to open, come in and find lower costs for certain procedures, that was a good thing. So you actually have a market mechanism causing pressure to on groups to find more innovative ways of delivering services. And that information, if you want to see the DRBs for Stockholm, again, is on our website. Here you can see that liver transplant was costed at $71,000  5-6 years ago. So if you want to save Medicare, you want to have public funding, you have no problem with that. You need transparent pricing. You need to move to a purchaser-provider split, in our view. That's what the most successful models in Europe are showing. And what you will see, dramatic productivity and customer performance improvements. And that's what we call structural reform. If you go to our website, there's more information on this. I guess I'll be happy to take your questions. Our website is www.fcpp.org. Thank you.